So electrophysiology is a subspeciality of cardiology that looks at the electrics of the heart specifically. It can be used to treat heart rhythm disturbances in patients that may cause palpitations or symptoms. We can use either medication in some patients, or we can use procedures such as keyhole procedures, such as ablation, to cauterize abnormal circuits within the heart. So electrophysiology is covers quite a wide range of conditions. Some patients have no structural heart disease at all. Others might have valvular disease or ischemic heart disease. But the essential criteria is that they have an abnormality of the electrics of the heart that will cause a heart rhythm disturbance. And this is treated by electrophysiologists. So the procedure is usually a keyhole procedure where we go up from the leg to the heart, and we put a patient into their heart rhythm disturbance and then map where it's coming from. Depending on the heart rhythm, this can be either something that's got a high success rate and is low risk, or if it's a very complex rhythm in patients who have an abnormal heart, it can be higher risk, and the success rate may be slightly lower. For patients, for example, with SVTs, the success rate is usually around 90 to 95%, and the risks are very small, less than 1 in 1,000 of anything serious happening. For patients who, for example, have coronary disease and have a complex rhythm disturbance, those risks are different and higher. So it depends on the heart rhythm disturbance, as we talked about. In patients who have a simple heart rhythm disturbance, it's extremely effective. The procedures can give patients quite instant symptom relief and improvement in their quality of life for a relatively low risk. And in other cases, if the rhythm's more complex, the success rate is lower, and also the risks are slightly higher. So for a simple ablation in an SVT, for example, it's about 3 days. It's mainly where we've got the access point in the leg. We ask people not to drive, and we ask people not to do any heavy lifting, just so that they don't get any bruising or hematoma in the leg. But in general, people can go about their normal lives quite quickly. In something more complex, it might be a couple of weeks or a few weeks after the procedure that they need to recover and take it easy.